Hi, Dr. Dave Webster. This is part one of, I think, a very important video. There's one video that I think pulls together almost all the reasons why PET-CT is so critical for patients in Ontario. It's this one. It really pulls together all the things that I spoke to you about before in the previous videos on the impact, or some of the impacts on patients in Ontario. Carol's life will literally become a living hell, as you will see, and this is 100% directly due to the Cancer Care Ontario's standards of care that doctors are forced to follow. Now, it also demonstrates why PET-CT has been the world standard of imaging management of cancer, lots of other diseases, dementia, head injury, post-head injury syndromes, cardiac disease, and so on for as much as 20 years, particularly when we look at lung cancer. I mean, this was available in Chile 20 years ago. Yet in Ontario, remember, our indications are the exact opposite of the entire rest of the world. It also, I think, will demonstrate to you just the utter and deliberate, cold-hearted, callous approach of Ontario's politicians and their experts to patients like Carol. And I want you to keep in mind as you watch this video that because of my attempts to prevent what you're about to see from happening to Carol, this led directly to me being threatened to lose my hospital privileges by the Ontario government, Cancer Care Ontario, and it also appears sadly, but unfortunately not unexpected, by the College of Physicians and Surgeons of Ontario. So, Carol's case will, I think, demonstrate that why, since 2005, Canadian and international PET experts have condemned in unprecedented terms and accusations what the Ontario Liberal government and their medical experts and what they have been prepared to do to our patients to block PET. We're going to see what their efforts did to Carol. Professor Rodney Hicks had mentioned before, an expert from Australia, and he said this statement to me. I want to remind you about because how important, and this should be shocking, and it should be hopefully enough to motivate us as both physicians and patients and just citizens of Ontario to act on this. But Ontario, he said, has the most egregious and politically motivated agenda against PET, and read our patients, of course, in the world. That's an extraordinary statement. Now, her case simply is, unfortunately, she's just retired as a nurse, finds out she has cancer of the cervix. Because she lives in Ontario, she has to have a CT, and she also happens to have an MR, trying to sort out what stage she is at in her cancer and what the appropriate treatments would be. I was asked by the patient, or Carol's oncologist, to act as an imaging consultant. Now, she should have had a PET-CT, but that wouldn't be allowed under normal OHIP indications, and so that you actually can go through PET Access, Cancer Care Ontario Committee, to consider other possibilities that you think might be useful for this patient. They won't, of course. Anyway, what got me into trouble, of course, was my approach to PET Access was going to be a little different. And we all agree that, I'm sure, accept the fact that if you live in Ontario as a patient, you should absolutely be entitled to a full answering of any questions and concerns you have about any proposed, tests and treatments and so on by your physicians or whoever hopefully is making the decisions that affect your health care. Now, given that my position is and remains is that Carol's physicians, including myself, were being forced to practice incompetent medicine with Carol, I insisted that the PET Access physicians themselves would answer Carol's very well-informed questions about why she couldn't get a PET-CT as part of her initial workup. And obviously, who better to answer these Carol's questions than those who actually would be making the decisions directly affecting, as you will see, her life, and in a very negative way. So, of course, as anticipated, they would allow Carol to have a PET-CT before she starts her treatments. So on the CT and MR of Carol, they can see that she has cancer of the cervix, but they also, remember, CT and MR basically look at the size of things, they're just anatomy, so they weren't sure there was something in the left side of her pelvis, but what they said is that the significance of this is simply not definitive. Now, she's also being seen and consulted by distance with McMaster University surgeon, and Carol is told that based on all the findings from the CT and MR and the information that the surgeon had, there was a good chance of a cure if she undergoes radical radiation therapy to her pelvis, followed by surgery. So her CT is used along with her MR to plan a full radical curative dose of radiation to her pelvis. Now, this is the kind of room that Carol would have been in. This is the kind of IMRT. I'll explain what that means. Intensity modulated radiation therapy. I will explain that in another video. But anyway, she was underneath and lying in this room by herself for at least 20 or more treatments. Now, in the meantime, of course, she begins to suffer from the anticipated complications because, of course, the radiation to kill cancer cells has to pass through normal tissue to get there. So this is not pictures of Carol's colon, of course, but this would be a normal colon. When someone looks in with a scope, take a look at that. That's what radiation damage to bowel and rectum looks like. I don't have to even have you, ask you what you think that might be like to experience. Plus, of course, your bladder's in the pelvis too, isn't it? So this is a normal-looking bladder, and this is the kind of radiation damage that we see in patients, and Carol did suffer from. Now, PET Access Committee graciously allows a PET CT only after she's undergone this horrific therapy with all these complications that she will now be living with to some degree forever. Now, of course, CCO, as expected, refuses to answer a single question or even acknowledge that Carol exists, basically. So this is into part one. And in part two, we're going to look at, so what exactly does PET CT show and what are the implications? So look forward to looking at that, and then we can talk about where to go maybe with this kind of information. Thanks for watching and paying attention, and please subscribe to my video channel. It's critical that this needs to get as far as possible. Thanks again.